In the past, many women born with a heart condition were told they would not be able to birth children safely. In 2015, St. Luke's Mid-America Heart Institute launched the St. Luke's Heart Conditions and Pregnancy Program, which follows a multidisciplinary approach to help women with cardiovascular conditions through pregnancy. This specialized clinic has now helped more than 2,000 patients become mothers. Thanks for joining us for this week's Health News You Can Use. I'm Lindsay Stish. With me today, I have Dr. Anna Grodzinksy, a cardiologist with St. Luke's Mid-America Heart Institute, and Dr. Winn, the medical director of St. Luke's Maternal Fetal Medicine Specialist. Thank you both so much for joining us today.
Thank you for having me. Yes.
So first, Dr. Grodzinksy, I'll ask you, St. Luke's has a specialized heart conditions and pregnancy program. Can you explain how this program benefits patients?
Yes, so this was really a first of its kind program, and it's unique in that a specialized obstetrician, otherwise known as a maternal fetal medicine doctor, sees the patients together with the cardiologist in one encounter to try to develop a great plan and optimize care during pregnancy and postpartum for moms with heart conditions during pregnancy.
Wow. And how has this model proven to improve outcomes?
Well, in our experience, so when we compare the pre to the post implementation of this clinical program, we've actually seen improvements in the C-section rates, in gestational age at delivery, at baby's birth at delivery. So all very positive trends.
That's fantastic. And Dr. Winn, how do the maternal fetal medicine and cardiology teams work together for these women who have heart conditions to have the healthiest and safest pregnancies?
Remember, pregnancy had two patients, mother and baby. And the cardiologist take care of the mom to make sure she's healthy, to go through pregnancy, also make sure to provide a healthy environment for the baby to grow inside the womb. And we as a maternal fetal medicine specialist, we monitor mom condition, also fetal condition, make sure baby grow well and in a good condition inside the womb. So we work well together, that's important, especially when we see patients, we see them patients together and provide information. Patients at the same time don't have to go so many trips. One to see cardiologist, one to see MFM physician.
Okay, that's great. That all makes sense. Now, Dr. Grodzinksy, what types of conditions do you monitor in this program?
So there has been a broad spectrum. Of the 2,000 plus moms we have seen so far, we see patients with benign palpitations of pregnancy all the way through a mom who has had 2 heart transplantations and pregnancy following that. So really a broad spectrum of conditions and everything in between.
That's fantastic. And Dr. Winn, now how do heart conditions impact a mother and baby during pregnancy?
So ma'am, the mom provide nutrients to the baby, no other way around. And to provide maximum nutrients and oxygen to the baby, you have to have good heart condition because the placenta depends on maternal blood flow to provide that nutrient and oxygen to the baby. So by optimizing heart condition, we can maximize the oxygen and nutrient to the baby, make sure baby optimize her growth and development inside the womb.
Right, great. Now, Dr. Grodzinksy, when is the best time for soon-to-be mothers to come into the clinic?
Well, we love for moms who are aware of their cardiovascular conditions before pregnancy to come in for something called a preconception visit. This allows us to make sure that mom's health conditions are optimized before considering pregnancy and to plan around that. But we recognize that's not always feasible, and so as soon as mom recognizes she's pregnant, we like to see her as soon as possible.
Okay. And Dr. Winn, what about pregnancy-related conditions that impact the heart, like preeclampsia?
So preeclampsia, as you mentioned, very important because it have impact, her blood, volume, her blood pressure, and also may have severe consequences on the pregnancy and the baby. And we know that by optimizing her heart condition, also vascular condition, you can minimize, even reduce the chance of having preeclampsia, and that maybe reduce the chance of preterm delivery of the babies.
And lastly, Dr. Grodzinksy, what final message do you have for viewers today, or is there anything else you want to add?
Well, I think the increasing recognition of heart conditions in young patients and young women is important. It allows us to do all we can to optimize the likelihood of a favorable outcome during pregnancy and delivery. And we've been able to parallel our clinical experience to our research world. And we're leading now something called the HOPE study, which is a study of 1,000 moms from 33 hospitals across the country in an effort to learn about what type of care delivery models are best in terms of optimizing mom and baby outcomes during pregnancy and delivery.
That's fantastic. So not only are you improving care here locally for mothers, but really advancing care for moms across the country.
That's the aim.
Great. And is there anything else that you'd like to add?
So, it's important to optimize her heart conditions, to provide the optimal environment for the fetus. Besides surviving, also the environment inside the womb affect that baby for years to come and become adulthood. So by optimizing that heart condition, her vascular condition, we can optimize condition, make sure baby is healthy as possible for years to come.
Fantastic. Well, thank you both so much for joining us.
Thank you for having us.
My pleasure to be here.
To learn more about St. Luke's Heart Conditions and Pregnancy Program, visit stlukeskc.org/heart-pregnancy. You can also stay up to date with all of the latest health news from St. Luke's at stlukeskc.org/news. Thanks again for watching. We'll see you next time on Health News You Can Use.